lose them. So you must have some aerobic exercise every day, but balance. You may need an hour-long nap in the late afternoon, early evening. I call that recharging your batteries. So balance. Because if you don't do any exercise and you lose muscles, your fatigue is going to go up. If you don't take that late afternoon nap, you may collapse and you have no time in the evening for your family. So I wish there was a perfect answer. And believe me, all lupus investigators know this is your #1 complaint. We keep hoping that one of the new clinical trials will shed more light on perhaps another or better way to address it. I want to give you a treatment update this morning. I'm going to start with the second most important message. So number 1 is hydroxychloroquine. Number 2 is the P in prednisone stands for poison. And you know, in spite of our best efforts, so many of you are stuck on some prednisone. Now, why is it bad? Because if the prednisone dose is above 6 milligrams, there is a 50% increase in permanent organ damage. And if you get up to above 18 milligrams, permanent organ damage goes up 2.5-fold. Here's the most alarming news. Cardiovascular disease is directly related to prednisone. So if the prednisone dose is between 10 and 19, the risk of cardiovascular events like heart attacks goes up almost 2.5 times. And if the prednisone dose gets above 20, the risk goes up 5 times. So every visit, I'm trying to help you get the prednisone down. Now, if it's below 6 milligrams, we're going to allow that if you need it for your quality of life. But those higher doses, I so want to get them down. And now you know why. Because remember, I'm not just thinking about how your lupus is today. I'm planning for the next 10, 20, 30 years. Now, one way we can keep prednisone down is when you have a flare of your lupus, we can treat it with just a short burst of steroid without trying to maintain any oral dose. And this study was called FLOAT, and we compared giving a medical dose pack with a shot in the bottom called triamcinolone. And although they both work, the triamcinolone did work a little bit faster. You see that partial improvement? But they both work. So we need to find more ways to keep everybody with lupus off the prednisone. You know, we never thought we'd be able to do that for kidney lupus, but in the United Kingdom, a kidney specialist is going to start to study a regimen for kidney lupus that does not involve prednisone. That seems almost miraculous, doesn't it? We all wish that her regimen will prove to be correct, but it will take her several years to prove it. Now, there is a new treatment, a biologic, that was FDA approved for active lupus. And it's called belimumab. You may have heard it called Benlysta. It was studied in huge trials around the world. And people who were on it during the trials continued on it and what's called open label extension to be able to prove long-term safety. This is what some people need when their lupus remains very active and is requiring a lot of prednisone. It seems to work best in a subset of people with lupus that have laboratory tests, anti-DNA, and low complement. But there are over 17 new biologics now in testing, what's called clinical trials. So it's everyone's hope that belimumab Benlysta is just the first of many new treatments for those who have very active lupus. Thank you very much for your attention this morning. Now, I'm going to answer questions, and if you pass your questions perhaps to the end of the aisles so they because if you have a bacterial infection, you will need antibiotics. Now, the next question is, do young children get lupus? And the answer is yes, it's rare, but young children can get lupus, and when young children get it, it is often kidney lupus. We think young children may get lupus because they've gotten a double dose of the predisposing genes. They may be getting them from both sides of the family, for example. Now, the next question is something that I know some of you are now facing. What do we do if the eye doctor has said that the hydroxychloroquine and plaquenil must be stopped because there is some deposition in the eye? We hate it when this happens. Remember, it's very rare. It's 1 person out of 5,000. But when it happens, we have no alternative medicine. There is no substitute for hydroxychloroquine. By the way, there's no substitute for vitamin D either. These are medicines that are unique. So someone who cannot take hydroxychloroquine, if their lupus acts up, they might need one of the immunosuppressive drugs like methotrexate, or flutamide, or mycophenolate, or azathioprine. And the next question is, I was told that pet cats can be an issue. Please don't worry about your pets. The reason that this came up was a long time ago. There was a study of pet dogs, and they interviewed the pet dogs. Maybe these were vets that did the interviews, and compared the pet dogs to people with lupus and people who didn't have lupus, and it turned out that the pet dogs and people with lupus were more likely to have lupus. But this doesn't mean that the transmission went from the dog to the human. Remember, when is lupus actually in your system? 5 to 7 years before you have the first symptom. This just means that there are environmental triggers which are infections. The most common one is actually the EB virus, one that you had as a child or a teenager. That's one of the triggers of lupus in people who are genetically predisposed. But it's fine for you to have a pet cat or a pet dog. Now, the next question is, does it matter which vitamin D supplement to take, D2 or D3? No, it doesn't matter which one. The usual replacement dose is 50,000 units each Sunday. I know you're thinking, 50,000, that sounds like an overdose, but its actual amount in milligrams is 1.25. Now, does it sound safe? Yeah. So you can take D2, you can take D3, you can take over the counter, you can take prescription. I know some of you are having problems that your insurance plans won't cover it because it is available over the counter. Don't get me started on insurance plans. Our next question is a follow-up with vitamin D. Can you take too much? Yes, we don't want your level to go above 100. 40 is desirable, and we don't let anyone get above 100. There are a few rare people, maybe there are 1 or 2 of you in the audience, that have too much of a hormone called parathyroid hormone, PTH. And in you, it may be a problem for you to take vitamin D, and your endocrine specialist will tell you yes or no. Next question is, can someone with lupus get the shingles, which is the chickenpox or zoster vaccine? Not if you're on prednisone or another immunosuppressive drug, because the shingles vaccine is a live virus, and there's a theoretical risk that it might spread throughout your system and cause inflammation in the brain. Now, the company that makes this has had years to make an inactive form. Doctors are so angry about this because the people who need the shingles vaccine the most are people who are on immunosuppressive drugs and people who have cancer. And these are the people who can't get a live vaccine. It's really crazy, isn't it? But eventually there will be an inactive form and everybody can have it. Now the next question is, can I have a flu shot? Yes. By the way, you can't escape me without my begging you to get the flu shot. And the reason is that 2 of my young patients died from the flu. And I've never And did you read the newspaper headline just a month ago that people who get the flu shot are less likely to have heart attacks? So, you know, there's good stuff, and there's nothing bad, because remember, there's nothing alive in the flu shot. And they now make them thimerosal free. So those of you who are worried about additives, they now make them free of thimerosal. The next question is very practical. I'm getting mouth ulcers from my lupus. How can I avoid them? We can't completely avoid them because we have no medicine yet that can cure lupus. But the minute you have a mouth ulcer that has started, please apply triamcinolone dental paste. Its brand name is Kenalog in Orabase. 3 times a day with a Q-tip. Don't do it just before a meal because your saliva will wash the medicine away. But this is a way to get the steroid right where it's needed without exposing your entire body. The next question is, tell me more about immunosuppressive drugs like methotrexate, azathioprine, mycophenolate, which is Celsep. What are their side effects? These medicines work for lupus because they reduce the immune response. And of course, lupus is embedded in the immune system. So if we reduce the immune response, we're going to reduce lupus. But we just reduce the good stuff as well. We don't have a way to reduce just lupus yet. So when we reduce the good part of the immune system, we increase the risk of getting an infection. And theoretically, we might be increasing the risk of later cancer, but it turns out lupus itself increases the risk of later cancer. So controlling lupus is the priority. This is why we track your blood count, the white blood count, because we don't want it to go too low. We usually never want it to go below 2.0. And we also will track your liver function test, because these medicines sometimes can bother the liver. That's rare, but if it's starting to bother the liver, we might have to reduce the dose. Now, we talked a little bit about what to do if there is an infection. If it's a common cold, it takes a week for it to get better. If you have high blood pressure, remember the only over-the-counter you can take for the common cold is called Coricidin, high blood pressure, HBP, because other over-the-counters can increase blood pressure. If you have a more serious infection, you must tell your doctor because you're likely to need an antibiotic. And if it's a very severe infection, like a pneumonia, it might be necessary to stop the immune suppression drug for a week to give your immune system a chance to rev up and fight that infection. Now, the next question is, do I need to take something to help my body absorb vitamin D? Usually not. 50,000 once a week will work for most people. The one exception is if you're overweight. Some people who are overweight need to take the vitamin D twice a week. There's a very rare condition called loop enteropathy. Its other name is celiac screw. People who have this autoimmune disease may also have lupus, and may have a particular problem in absorbing some things, such as vitamins. So if you have gluten enteropathy, your doctor will help you with that. Now the next question is CTA. Why should everybody with lupus do this? Hopkins has to perfect the software that gives an accurate reading of that green plaque in order to make it widely available. We need to have buy-in from insurance companies because this is thousands of dollars. And though I think every one of you is worth thousands of dollars, insurance companies don't agree with you. We know that. I'm sure many of you have had to do prior authorizations. Some of you have had to do prior authorizations for a generic medicine. Yes, that's how awful insurance companies can be. Remember, they don't think of you as the priority. They think of saving money as the priority. But I hope that in a couple of years, CT angio will become standard of care. there, it was the tortoise. The slow and steady can be much more successful than the fad or crash diets. Okay, I'm going to take two more. So the next one, is there a correlation between fibromyalgia and mental illness? No. You're not crazy. That's why I told you about the doctor in Ann Arbor, Michigan, who proved that in fibromyalgia, 2 areas of the brain had rewired. Some doctors don't catch up on the literature, and some doctors don't even believe in fibromyalgia. But now that it's proven on functional brain MRI, all physicians should be true believers. And it has a medical name. The medical name is chronic pain sensitization. It means that in someone with fibromyalgia, the neurologic system is on red alert. And so just a gentle touch, So this is not your fault. You didn't do anything bad to cause it. You are not mentally ill. It is a medical condition. And it can be treated. We talked about the benefit of Tai Chi. There are some medications that are FDA approved that are beneficial, including gabapentin, Cymbalta, Savella. Why don't I like Lyrica so much? Weight gain. So even though it's widely televised, you've seen all those ads. I do too. Many of you are fighting your weight, and a medicine that increases appetite and weight is not going to be the best choice. Now this is going to be the last question. Let me find the perfect one here. What is my blood pressure goal? Repeat after me. What is the blood pressure goal? What's the number? 120. Now, you get to teach your other doctors this, don't you? Because my generation of doctors, when we went to medical school, we were taught that 140 over 90 was the goal. No more. 120 over 80 is normal. So everyone here wants to achieve normal blood pressure because even being 1 millimeter above normal increases the risk of a stroke or a heart attack. Now, it isn't easy. If it was easy, we all achieve the goal. We have to change our lifestyle because there's salt in so many things. And if you have a diet that's high in salt, it's the equivalent of pouring gasoline on the fire. We have to exercise and lose weight because that's beneficial for our blood pressure. And we have to take our blood pressure medicines every single